Good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Speakers are joining the briefing virtually to adhere to social distancing guidelines. And today, in addition to the mayor, the managing director, and the health commissioner, we are also joined by Chief Administrative Officer Stephanie Tipton and City Solicitor Marcel Pratt. We will begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Mike. And before we get into our planned remarks regarding Philadelphia's reopening, I feel compelled to first touch on the tragic events that have transpired in recent weeks, leading to growing unrest in communities all across the country. In the midst of a global pandemic, America's original sin of racism has not gone dormant. We saw a video of Ahmaud Arbery being murdered by two white men while simply out for a run. We heard the news of Breonna Taylor being shot to death by police who entered the wrong home when serving a no-knock warrant. And just this week, we saw the senseless killing of George Floyd at the hands of officers in Minneapolis. Black Americans are outraged, and they should be. I'm outraged too. As a white man, I will never know the heartbreak and trauma that the Black community continues to experience. But I want Black Philadelphians to know that I and other city leaders stand with them and are here to support them during this painful time. You should not have to bear witness to the killing of yet another unarmed Black person. You should not have to feel as though society believes your lives are less valuable than white people. And you should not fear for your lives or for your loved ones' lives when simply stepping outside the house. Last night, the president unbelievably openly threatened the shooting of protesters in Minneapolis. This morning, we saw a Black CNN reporter and his crew arrested live on the air just for doing their jobs. All of this is totally unacceptable. I want Philadelphians to know that Commissioner Outlaw and her team are committed to serving our communities with fairness and sincerity. Sometimes we stumble, sometimes we fail, but every day the public servants of this city are working to make Philadelphia safer, healthier, and a better place for all of us to live. Our commitment to you is that we continue to improve this level of service and to ensure that everyone is treated with the dignity and respect that they deserve. I also want to acknowledge the unfortunate news we had this morning of an off-duty police lieutenant shot in South Philadelphia. Luckily, Lieutenant Friel is in stable condition and recovering at Jefferson Hospital. His injury comes as we continue to see acts of gun violence rising in our city. And we said before, the plague of gun violence is a public health crisis in Philadelphia and is not going away while we battle the pressing public health threat from COVID-19. I want to thank all of our law enforcement officers for their continued service during this crisis, and every day they put their lives on the line when they put on their uniforms. And for all Philadelphians who are struggling under the weight of these recent but not uncommon tragedies, know that we see you, we hear you, and we love you. Now, on to the reopening plan that we promised to share today. It has now been 1 week since Governor Wolf announced that Philadelphia was among the counties that would be able to move to the yellow phase on June 5th. Excuse me. Today, I'm pleased to announce a plan and executive order outlining the strategy for how Philadelphia will approach the easing of business restrictions and personal activity. We call it Safer at Home, and that title is very intentional. Because despite the easing of restrictions, it is still very much safer to stay at home when possible. I cannot stress that enough. This move to yellow is welcome, but it is not by any means a return to normalcy. Philadelphia must approach the next phase of COVID-19 pandemic in a way that balances the risks of the virus with the further social and economic damage that could be caused by a continuation of the current restrictions. So our strategy allows a number of activities to gradually resume in a way that continues to suppress the virus and keep as many Philadelphians safe and healthy as possible. But again, we are all still safer at home and should only leave to engage in essential activities. This is true for all city residents, and even more so for Philadelphians who are 65 years old or older, who have long-term health conditions, or who live or care for someone who meets those criteria. Under the yellow phase, a wide range of lower-risk businesses and activities will be permitted to resume, so long as they operate within certain parameters spelled out in the new order and the plan. These include restaurants that allow for walk-up ordering, food trucks, outdoor youth day camps and recreation, office-based businesses, manufacturing, and warehouse operations. Retail businesses will be allowed to resume operation, although curbside sales and delivery are strongly encouraged. We know many of you, business owners and operators, workers and residents, are going to have questions. The website has much of this information. If you could visit phila.gov/safer at home to see more detailed guidance on how to safely resume these activities. Again, that's phila.gov/safer at home. As was the case during the stay-at-home order, employees or customers who want to report possible health and safety violations in the workplace related to COVID-19 can contact 311. Businesses should note that violations could result in fines, penalties, and license suspension. Joining us today for the announcement are two city officials whose work has been integral to our Safer at Home plan. City Solicitor Marcel Pratt, who leads the law department and helped craft the new order, and Stephanie Tipton, our Chief Administrative Officer, who has developed a plan that will allow for the resumption of city services that have been curtailed during the crisis. Dr. Farley and Stephanie will offer a presentation in a few moments to provide more details on the plan. I want to close by urging everyone to be cautious. Use your common sense. I know we're anxious to enjoy the warm weather, to reunite with friends, and to enjoy the great food, shopping, and recreation that our city offers. I know we're thrilled that the stay-at-home order or red phase could be a thing of the past, but social distancing is not going away. You need to stay 6 feet apart. You need to wear masks, and you need to avoid gatherings of any size. We may be heading into yellow, but we all are still very much, again, safer at home. And as our region begins to enter a phased reopening, all of us, residents, government officials, businesses, healthcare providers, and more, have a shared responsibility to ensure our city is able to make a full recovery. The city is committed to emerging from this month's long shutdown as quickly as possible, but we need everyone to do what is right and continue following the guidance provided by the Department of Public Health. It is clear that the work of Philadelphians thus far has put us in a much safer position than we were just 2 months ago, but we are not out of the woods yet. COVID-19 is still present in our communities and poses a real threat if we don't take things seriously as the city reopens. To successfully navigate the next phase of our recovery, we need all Philadelphians to embrace the shared responsibility at this critical moment in our city's history. Please help us get there. And now, Dr. Farley.
Thank you very much, Mayor. The main thing I want to do is lay out our strategy for the safer at home phase. But first, let me just update you with some of the numbers on the epidemic. Since this time yesterday, we confirmed 255 additional cases of the coronavirus infection, bringing us to a total of 22,405 since the beginning of the epidemic. Now, 225 is a higher number than we've seen on some individual days before, but we did have a large number of tests reported to us today. In the city's jail, we've had 0 new symptomatic cases among inmates. The screening of asymptomatic inmates is ongoing. In the city's hospitals, as of yesterday afternoon, there were 469 inpatients in the city hospitals. There were 912 inpatients with coronavirus infection in hospitals across the Southeast Pennsylvania region. Both those numbers are a decrease from yesterday. And since this time yesterday, we've confirmed 20 new deaths from coronavirus infection in Philadelphia residents, bringing us to a total of 1,278 since the beginning of the epidemic, of which 678 or 53% are nursing home residents. With that, now I'm going to try to share my screen and so I can show a PowerPoint as I lay out the safer at home strategy. So give me a second to get that going. And I'm going to ask our press officers if you are seeing the screen that you should be seeing.
We are good to go, Doctor.
Right. Thanks very much. So I want to lay out the strategy for the next phase, which we are calling Safer at Home. I want to be clear to everyone, this is not returning to where we were before the epidemic. This is not reopening Philadelphia. This is a cautious restart of certain activities, which we think are important to get the economy moving in a way that we think can continue to suppress the virus. I'm going to lay out the strategy for that, and then I'm going to lay out the specific implications of that strategy for businesses that are allowed to restart, as well as organizations that are allowed to restart activities, and implications for individual Philadelphia residents. First, though, I want to back up a little bit and give you a sense of where we've been and what we've accomplished so far. So this is a graph that just shows what Philadelphia residents have done over the past few months with our recommendations. In the middle of March, in response to the risk of the coronavirus infection, The city issued an order to close schools on March 13th, an order to close businesses on March 17th, and a stay-at-home order on March 23rd. What the graph is showing here is the percent of time that people in Philadelphia spent at home. This is based on data from an organization called SafeGraph, which gets information from cell phones, and they know how much of the time that cell phone is at a person's home. As you can see from the graph, before we issued those orders, about 75% of the time, cell phones were at home. Afterwards, that number rose to well over 97% and is still at a very high level. So the point here is that Philadelphia residents have listened to this recommendation to stay at home, and that has had some real positive implications as far as the epidemic. This graph shows the number of cases of the coronavirus infection in Philadelphia residents by the date at which the test was done from the beginning of March until just a few days ago. The height of the bar is how many cases were reported that day. As you can see, the orders started in the middle of March. We had an epidemic wave that crested in the middle of April with about close to 600 cases per day at its peak. Since that, and as a result of people staying at home, that's now fallen to where we're now a little bit below 200 cases per day on average. And that has benefited us in terms of reducing the number of deaths from this infection. This is a graph of the number of people who are died, confirmed from the COVID-19 infection by the date of death. The orange bars reflect people who are in nursing home residents. We know that this epidemic has been particularly bad in nursing homes. And the blue bars are people who are not nursing home residents. Both of those numbers peaked in the middle of April, a little bit later than the peak of the epidemic overall, but they've fallen substantially since then. So now we're getting on average a little less than 10 deaths per day. Not zero, but many fewer than we had at the worst of this. With that in mind, we do feel that we can move to the next phase of the epidemic, which is our safer at home, or what the governor would view as the yellow phase of our response. There are three elements to our strategy for doing this in a way that protects us against the virus: containment, social distancing, and protecting vulnerable populations. I want to explain what each of those is in turn. What do I mean by containment? Containment is about identifying as many cases of the infection as possible, and then doing everything we can to try to stop this chain of spread of that infection to other people. So that will involve a scale-up of testing. We currently have just short of 50 testing sites across the city. We will increase the number of testing sites. We'll increase the number of tests that we do. We will be doing outreach to particularly vulnerable populations and populations that have a disproportionate impact from the epidemic. And as much as technology allows us, we want to get the test results as quickly as possible. Right now, we're getting a turnaround time of 24 to 48 hours. We'd like to bring that down to just a matter of a few hours. Then we will be doing contact tracing. That involves interviewing people with the infection to identify those that they may have exposed, known as their contacts, and then notifying and counseling those contacts to try to get them to take actions that would prevent the chain of transmission. We'll be asking cases to isolate themselves, that is to say, stay home, so they don't spread the infection onto others. And the contacts to similarly quarantine themselves, that is to say, even though they don't have the infection, to stay home, so that if they do develop the infection, they're not spreading it to other people. That whole group of activities falls under containment. Second element of the strategy is social distancing. And this will involve a stepwise scale back of current restrictions, not returning to where we were before, but just a stepwise, very gradual scale back of current restrictions in a way to reduce the risk of transmission as much as possible. That's what we're going to call our safe mode precautions. I'm going to be talking more about what our safe mode precautions are in just a minute. Then we will be following very closely numbers to indicate whether we're continue to make progress against the epidemic, or whether anything we're doing is showing that we are reversing. The virus is starting to resurge. In particular, we have, in addition to our overall metrics, 2 early warning signs, which we would hope to be early triggers, indicate that we may have gone too far. And if we have early warning signs or metrics that indicate we're going in the wrong direction, we will reinstitute restrictions if we see that there's any sign that the virus is resurging. An overview of how this all fits together is shown here, and how this relates to the governor's plan. The governor has 3 different colors. There's red, yellow, and green phases. We are currently in the red phase. There are certain activities that are allowed in the red phase that are considered just essential for everyone, such as being able to go to pharmacies and access healthcare, buy food. The yellow has other activities that are allowed that are the lowest risk activities. Retail businesses, childcare centers, outdoor day camps, office-based businesses, and manufacturing and warehouse operations. I'm going to talk more about those businesses in a minute, but you can see how this fits in the overall scheme. At some point in the future, but not anytime soon, if everything goes well, we would move on to a green phase. The third element of the safer at home strategy is protecting vulnerable populations. The virus affects some people much more so than others. It has higher disproportionate impact on racial and ethnic minorities. So the city will develop and issue a racial equity plan specifically to address this. It is developing this. So to date, internally, it will be working with external partners on developing to come up with a plan that's as effective as possible. Another group that's vulnerable are residents of long-term care facilities, nursing homes specifically. We are and will continue to work with nursing homes to try to prevent spread within those facilities, including providing personal protective equipment, having a policy of universal masking. Everyone wears a mask at all time. Testing of residents before admission to try to prevent the virus from getting into the facility. We will be supporting the testing of residents and staff, and we'll be supporting these facilities with various infection control practices to prevent spread of the virus if it does get into the facility. And then we'll be working with other congregate settings. Those are settings where people live together and which we know are at high risk for this virus to spread. This is how we're going to track our progress. These are the metrics, the measures, the numbers that we'll be looking at to see whether we're continuing to make progress. Let me just go through this if I could. First, we'll just see how much of the virus is around. I'm just looking at what our case counts are every day. The lower the count, lower a number of people are out there with infection, the better off we are. And we'll also be seeing what the direction is. Is the number of cases per day going up or going down? If it's going down, that means the reproductive rate of the virus is less than 1. It means that on average, a person who's infected passes that infection on to fewer than one person's. And that's a very good sign that the social distancing steps we're taking are working. We'll look at adherence to guidance. I'm trying to measure, we haven't done that yet, but we will measure use of masks in interior public settings. And we're going to measure our effectiveness of our containment activities with the number of test sites, the number of tests performed, the percent of cases that are interviewed, on the percent of contacts that are reached and agreed to quarantine. We will track our health care system capacity with the number of COVID-19 hospital inpatients compared to peak. Right now, they're about half what they were at their peak, which means we have additional capacity to spare. And we'll measure the effectiveness of our protections to vulnerable populations, like how many cases we have specifically in nursing home residents. In addition to those metrics, we have 2 early warning signs that we will be tracking. This is one that comes from data in hospital emergency departments. When people come into hospital emergency departments, you learn what their symptoms are. They may or may not be tested for COVID-19, but even if they're not tested, their symptoms can be an indicator of a virus returning if their symptoms show respiratory symptoms or fever. And so we looked retrospectively at data over the past few years of how many people have gone into hospital emergency departments with symptoms that would typically be of, or could typically be of COVID-19. What you see in this graph in the gray lines is the data from previous years. What you see in the red line is the percent of emergency department visitors who have these compatible symptoms in 2020. And you see this very large spike that occurred starting in early March and continuing until early May. It is very consistent with the epidemic. This looks like a good early warning sign that even if people are inadequately tested, if this number starts to surge, it can give us a sign that maybe things have gone awry. We also will be working with a company called Kinsa that distributes thermometers that put their information into the internet. And through that, they can measure the percent of people whose temperatures are checked where the temperature reflects a fever and show that relative to what you would expect during that time of year. You expect to have more fevers during the annual flu season. But as this showed, during the early March period through early April period here in Philadelphia, there was an unusual increase in the number of temperatures that were measured that reflected a fever. It was probably an indicator of the coronavirus infection, the epidemic occurring in the city. Those 2 numbers together should be the best early warning signs that don't depend necessarily on testing. So that's how we're going to measure this. Then how are we going to restart activities in a way that is safe? We're doing this in a way that we refer to as safe mode. That term has to do with where the computers, I'm not sure if they still are, but the way they used to be, if your computer had a virus and it froze and you had to reboot your computer in order to get it restarted, you would be asked, do you want to start in safe mode? That is restarting the minimal activities the computer needs in order to function so that you can rid your computer of that virus while protecting the computer. That's a parallel to what we're talking about here. How can we reboot the city, restart the city with the minimal level of activities that enables the economy to move in a way that enables us then to further combat the virus. So it really is not, it's not reopening. It's not doing what we used to do before. It's a very protected way of operating. What is allowed or what will be allowed in this safer at home yellow phase? Currently, the activities that are allowed are healthcare, pharmacies, groceries, restaurants with certain restrictions of carry-on delivery only, construction, and transportation. What we're adding as of June 5th, assuming the numbers continue to look good, so it's tentative, would be retail businesses with restrictions, office-based businesses, where we still strongly encourage people working remotely, or as it's written here, telework, childcare centers, outdoor day camps, manufacturing, and warehouse operations. For each of these activities and businesses, there will be 8 different elements of safety that they need to put in place in order to reduce the risk of spread of coronavirus from one person to another in that context. Becomes a safety checklist with 8 elements. Those 8 elements will apply differently to different settings, but there's a common theme to all of them. They include using and requiring people to use masks, barriers to prevent the spread of the droplets from one person to another, reducing crowds so that if the virus were present, would reduce the number of people who might be exposed, distance, keeping people physically apart so that the droplets are less likely to reach another person, would include isolate, that is to say, identifying employees or people who may be showing symptoms early on and preventing them from working and being at the site while they have those symptoms, having them isolate at home. Includes hand washing, includes cleaning high-touch surfaces, and includes communicating the rules to everyone who is using that facility or is involved in that activity, such as putting up signs. Signage can be very important, letting people know what behavior is expected. So how would these elements apply to a typical situation? Let's say a retail store. For masks, store managers will be required to provide masks to their employees and to require the employees and the customers to wear masks in the facility at all times. It would require them to install barriers, plexiglass barriers at cashiers to protect the spread of the droplets from a customer and to an employee or vice versa. Require them to screen employees with symptoms and isolate them, that is to say, have them stay home while they're ill. It involves them enforcing distancing within the facility, such as through floor decals, and separating cashiers by more than 6 feet so that the cashiers themselves are within a safe distance from each other. It involves reducing crowd size. So as much as possible, we want retail stores to promote online ordering and curbside pickup. We really want that to be done as much as possible. However, stores can allow indoor shopping if they follow the rule of fewer than 5 customers per 1,000 square feet. That means they're going to have to limit the number of customers who walk in the door. Hand washing, they have to provide hand sanitizer on entry. And cleaning, they need to wipe down high-touch surfaces every 4 hours. And finally, communicate. They'll need to put up signage so everybody knows what the rules are for everyone to behave in that facility. So those are the guidelines. Let's talk about enforcement now. How will we enforce that? Well, these rules will be enforced as much as possible through city inspectors, such as those inspectors of the Department of Public Health, but there are other inspectors as well in the city. That's as much as possible. However, we recognize that there are not enough inspectors to be in every store and every organization across the city of Philadelphia every day. And so we are asking and we are imploring businesses and other activity organizers to do their own enforcement, to take this seriously. This is important for everyone. This is important for the operations of everyone. Everyone has to be involved in enforcing these rules or it doesn't work. And in turn, we're going to ask every Philadelphian to help with enforcement. Now, people may feel that they don't have the ability to enforce, but simply reminding people of the rules can have a big effect. It may be as simple as a customer saying to a businessman, I noticed that some of your staff are not wearing masks. They're supposed to wear masks. Or it may involve them saying to another person, you're supposed to wear a mask in this setting we're in. Or it may involve a person telling a businessman, I think there are more people in the store than are allowed under the city's rules. So if everyone simply reminds everyone else of what these rules are, we can get a high level of compliance. Now there's one key area where our rules differ somewhat from the state's guidelines. Under the state's guidelines, social gatherings, religious gatherings of up to 25 people are permitted. However, with our safe mode operations, we are not recommending social gatherings of any size. The reason is that there is potential for a very prolonged close contact in social gatherings. People often may not be wearing masks, and they're not regulated or monitored. So we are concerned about these social gatherings. We call that religious gatherings specifically because I am concerned that there may be religious gatherings. We know that meetings of faith are very, very important in our society. But if you have 25 people coming together and singing, for example, there is really a risk of spread from one person to another. There was a recent report from the Centers for Disease Control about a choir practice in which 61 people participated. One person was ill. After that practice, 52 people became ill, 3 were hospitalized, and 2 died. So social gatherings, religious gatherings where people are not following social distancing rules can be very dangerous. So while these are permitted under the state's order, we are not recommending these gatherings of any size. So then people may ask, what does this mean for me? What does this mean for your average Philadelphia resident? Well, it means, first of all, you are still safer at home, that you can go out and do these activities, but as much as possible, we would recommend you stay home. This is especially important for people who are more likely to get serious infections, such as people over the age of 65, people with chronic health conditions, or people who live with people who are over 65 or have chronic health conditions. You don't want to bring the infection back to your loved ones at home. It means when you are away from home, you'll need to be wearing a mask. You need to have a distance from other people. You need to wash your hands. Your individual behavior, in addition to reminding other people about what the rules are, will make a big difference. So that's the overall strategy, and that's what it means for businesses and individuals. In finishing, I want to just thank everyone for getting us to where we are right now. We wouldn't be at this point if it weren't for the fact that people in Philadelphia have really stepped up and taken our guidance seriously and helped protect each other. The fact of the matter is that we need to have that same level of compliance and cooperation going forward. We are all in this together. That is not a political slogan. That is simply a fact of this epidemic. That people, if no one follows these rules, everyone suffers. Some people don't follow the rules, many people suffer. If we all follow the rules, everybody benefits. So we are all stuck in this together. Everybody takes these seriously. We can restart our economy and still protect our city. With that, now I'll turn it over to our Chief Administrative Officer, Stephanie Tipton, who's going to talk about the implications of this for city services.
Good afternoon. As Dr. Farley mentioned, I'm Stephanie Tipton. I'm the Chief Administrative Officer for the City of Philadelphia. I'm now going to describe very briefly the city government strategy and approach to safely resuming additional city services as part of our Safe Return to Work program. So what I'm going to do is try to share my screen. I do that successfully. There we go. All right. Can everyone see that?
We are good, Stephanie. Go ahead.
Great.
Thank you.
And just let me pull up one more thing here. Okay. Can everyone still see that? Great. So the objective of the city's Safe Return to Work program is to begin to bring city employees back to work in a phased manner based on a prioritized schedule that aligns with city and state guidelines for the safe reopening of various businesses and industries, while also minimizing the potential for the spread of COVID-19 in the workplace. As public servants, it's important that we lead by example, and we take precautions consistently to protect not only our employees, but the residents that we serve. Ensuring a safe return to work will be a shared responsibility between city departments, employees, and the public. So our guiding principles as we begin reopening city operations are the following. It's going to be a phased approach. We will focus on prioritizing critical public-facing services that were not already operational during the red phase. And our ultimate goal is keeping our workforce and our public safe. So our approach as we move into the yellow phase is to reopen limited public-facing services in a phased manner. This is in addition to the many essential services that are already and will continue to be fully operational during the red phase. With this approach, the public should not expect that on June 5th, all city services are going to reopen. We continue to work very closely with city departments on the reopening plans and the timelines around those plans. During the yellow phase, we're prioritizing reopening city services that support business activities that are resuming in the yellow phase, as mentioned by Dr. Farley, our regulatory and appeals agencies, our revenue generating activities, and also that support vendor payments. Operations that are currently being done remotely will continue to be done remotely. As Dr. Farley mentioned, telework is still very strongly recommended, and we're going to continue that as well with our workforce. Some examples of the types of services that will begin to reopen throughout the yellow phase include such things as expanded deed recording with our records department, in-person water bill and tax payments in the municipal services building concourse, and some administrative and adjudicative boards like the tax review board, for example. As mentioned previously, many of these services will reopen again in a phased manner throughout the yellow phase. We'll continue to provide more information in the coming weeks about what services will be starting up and when, as well as how the public can access them safely. As always, our number one priority is keeping our workforce and the public safe while they access city services. How we're going to do this is by adhering to the safety checklist that was developed by the health department and that Dr. Farley mentioned and described in his remarks, as well as our own internal guidelines for a safe return to work. We're going to ensure appropriate social distancing and reducing crowds by moving most in-person interactions to appointment only or virtually where possible. We're going to have limited hours of operation to accommodate staggered shifts for our employees, again, to encourage and promote social distancing wherever possible. And by requiring universal masking for our employees and any member of the public that's going to be accessing these services, among other safety measures that we'll be implementing. Again, our ultimate goal is to ensure a safe return to work for our employees while meeting the needs of our residents. So that concludes my remarks, and I will stay on to answer any questions that folks might have.
Great. Thank you, Stephanie. And now we go to Armando for the Spanish language translation of the mayor's, Dr. Farley's, and Stephanie Tipton's comments. Armando, you need to unmute yourself. There we go.
Thank you. Mensaje del alcalde Jim Kenney para el día viernes 29 de mayo del 2020. Buenas tardes a todos. Quiero comenzar hoy con algunas reflexiones. En medio de esta pandemia global, lamentablemente, el racismo continúa en los Estados Unidos. Vimos un video de 2 hombres blancos que a sangre fría asesinaron a Matt Arbery mientras él salía a correr. Estamos escuchando la noticia de cómo Breonna Taylor fue asesinada a tiros por agentes de la policía que ingresaron en la casa equivocada. Y justo esta semana hemos visto el asesinato sin sentido de George Floyd a manos de policías en Minneapolis. Los estadounidenses afroamericanos están indignados, pero honestamente, todos debiéramos estarlo. Quiero enviarle un mensaje a la comunidad afroamericana de Filadelfia. Todos los líderes de la ciudad estamos aquí para apoyarlos durante estos momentos tan indignantes. Ningún asesinato debiera ser desestimado. Nadie debe sentir que su vida es menos valiosa que la vida de una persona blanca. Y nadie debe temer por su vida o por la de sus seres queridos cuando sencillamente salen de casa. Anoche, el presidente amenazó abiertamente con dispararles a los manifestantes en Minneapolis. Esta mañana vimos cómo un reportero afroamericano de CNN y su equipo fueron arrestados en vivo mientras cumplían con hacer su trabajo. Todo esto es inaceptable. Quiero que los habitantes de Filadelfia sepan que la comisionada Outlaw y su equipo están comprometidos a servir a nuestras comunidades con justicia. Hoy también debemos anunciar otra desafortunada noticia relacionada con la violencia armada. un teniente de la policía de Filadelfia fuera de servicio recibió un balazo en el sur de la ciudad. Afortunadamente, el teniente Friel está recuperándose en condición estable en el hospital de Jefferson. Les agradezco a todos nuestros agentes de la policía por su servicio continuo durante esta crisis. Y para todos los habitantes de Filadelfia que sufren las consecuencias de estas tragedias por la violencia armada, quiero que sepan, estamos con ustedes. En otro tema, ahora sí compartiremos los detalles sobre el plan de reapertura que prometimos para el día de hoy. Ha pasado una semana desde que el gobernador Walsh anunció que Filadelfia estaba entre los condados que podrían pasar a la fase amarilla este 5 de junio. El plan que anunciaremos hoy se llama Más seguro en casa o Safer at Home y abarcará la reducción de las restricciones comerciales. Necesitamos comprender algo. Este cambio a la fase amarilla es bienvenido, pero de ninguna manera es un regreso a la normalidad que conocíamos. Nuestra estrategia permite que se reanuden gradualmente una serie de actividades de manera que se continúe con la contención del virus, permitiendo mantener la seguridad de nuestros residentes. En la fase amarilla, se permitirá reanudar una amplia gama de negocios y actividades de riesgo bajo, siempre y cuando operen dentro de ciertos parámetros que detalla la nueva orden. Entre las actividades permitidas podemos mencionar las siguientes. Las personas otra vez podrán pedir sus órdenes en los restaurantes y se autoriza la operación de los food trucks. Se permiten nuevamente las actividades de recreación al aire libre y los campamentos para jóvenes. Las oficinas, almacenes y fábricas están autorizados a reiniciar actividades siempre y cuando cumplan con ciertas normas. Los negocios minoristas podrán reanudar sus operaciones, aunque se recomienda entregar los productos sin tener contacto con el comprador. Sabemos que muchos de ustedes, dueños de negocios, trabajadores y residentes, van a tener preguntas al respecto. Para ello pueden visitar fila.gov/Safer in Home para revisar una guía más detallada sobre cómo reanudar las actividades de manera segura. Asimismo, los empleados o clientes que deseen denunciar violaciones potenciales a las normas de salud y seguridad relacionadas con el COVID-19 en sus trabajos pueden llamar al 311. Las empresas deben tener en cuenta que las violaciones pueden resultar en multas, sanciones y en la suspensión de su licencia comercial. Sé que tenemos muchas ganas de disfrutar del clima cálido, reunirnos con amigos y disfrutar de la excelente comida y recreación que nos ofrece Filadelfia. Pero el distanciamiento social no va a desaparecer. Debemos mantenernos a 6 pies de distancia de otras personas. Necesitamos usar máscaras al salir de casa y debemos evitar las reuniones sociales de cualquier tamaño. Nos estamos encaminando hacia la fase amarilla, pero todos estamos mucho más seguros, repito, muchos más seguros en casa. La ciudad está comprometida a reabrir lo más rápido posible, pero necesitamos que todos hagan lo correcto y continúen cumpliendo con las normas del Departamento de Salud Pública, y estoy seguro de que podremos contar con su apoyo para esto. Estos son los breves comentarios de Stephanie Tipton, directora administrativa de la ciudad de Filadelfia, sobre la reapertura de los servicios municipales que se habían reducido durante la crisis del COVID-19. El objetivo del programa de regreso seguro al trabajo de la ciudad de Filadelfia es comenzar la vuelta al trabajo de manera gradual. Esto se realizará siguiendo un cronograma de acuerdo a las pautas de la ciudad y el Estado para la reapertura segura de negocios e industrias, minimizando el riesgo potencial de propagación del COVID-19 en el lugar de trabajo. Nuestro enfoque a medida que avanzamos en la fase amarilla es de reabrir servicios públicos limitados de manera gradual. Según este enfoque, el público no debiera esperar que el 5 de junio todos los servicios de la ciudad vuelvan a abrir. Continuamos trabajando en los planes de reapertura de los departamentos de la ciudad muy cercanamente con ellos. Durante la fase amarilla estamos priorizando la reapertura de los servicios de la ciudad que apoyen las actividades comerciales que se reanuden durante la fase amarilla, correspondan a las agencias reguladoras, generen ingresos para la ciudad y le den apoyo a los pagos a los proveedores. Las operaciones que actualmente se realizan remotamente, en la mayoría de los casos, continuarán haciéndose de forma remota. Estos son algunos de los ejemplos de los tipos de servicios que comenzarán a reabrirse durante la fase amarilla. El pago de impuestos y facturas de agua en persona, así como revisiones y permisos de planes de licencias e inspecciones en el edificio de servicios municipales. Algunas juntas administrativas y adjudicativas, como la Junta de Revisión Fiscal. Nuestra meta es asegurar un regreso seguro al trabajo para nuestros trabajadores mientras satisfacemos las necesidades de nuestros residentes. Y esta Es la actualización en materia de salud para el viernes 29 de mayo del año 2020. Desde ayer se han confirmado 255 casos del coronavirus en Filadelfia. Actualmente tenemos un total de 22.405 casos en la ciudad. Hoy hemos recibido un número mayor de resultados, pero no tenemos nuevos casos del COVID-19 en las cárceles. Lamentablemente, hoy también reportamos 20 muertes por el COVID-19 en la ciudad. Hay un total de 1.278 personas que han muerto por la COVID-19. 678, el 53% de estas muertes, han sido en hogares de ancianos. Hay que recordar que este virus no discrimina por raza o por género. Informamos que hasta ayer en la tarde 469 personas han sido hospitalizadas en Filadelfia y 912 personas en la región sureste de Pensilvania. Estos resultados reflejan un descenso en el número de pacientes hospitalizados. Alentamos a todas las personas de cualquier edad que tengan fiebre o problemas respiratorios a realizarse la prueba del COVID-19. Las pruebas están disponibles en casi 50 centros ubicados a lo largo y ancho de la ciudad. Con su ayuda, el retorno a la normalidad será de manera más rápida y segura. Juntos podremos superar este gran reto. Gracias.
Thank you, Armando. And we're now going to move to the Q&A portion for members of the media. Today, because of the presentations that we just saw, time is even more limited than normal. Reporters, as usual, are asked to limit their questions for each round to 3 or fewer, and that includes follow-up questions. Today, we are strictly enforcing that limit in order to be fair to other reporters and in light of our limited time. We will do a second round of questions if time permits. Also, a reminder that in addition to the mayor, the managing director, and the health commissioner, we have Stephanie Tipton, who you just heard from, our chief administrative officer, and city solicitor Marcel, whose law department crafted the executive order. They are both available to answer your questions. First, we go to Mitch Blocker of NBC 10.
Good afternoon. I have a question initially for Dr. Farley. I'm wondering, I know you laid out the metrics, is there a number that would trigger a step back into the red phase or potentially a step forward into the green phase?
I would not look at a single number. We can look at several different metrics in our early warning signs. But I can say that if we're seeing a combination of numbers that shows a substantial increase in viral activity, then I would certainly want to delay going into the yellow phase or going back into the go into the red phase.
And I am curious your thoughts on this question as well as the mayor's. Do you think we're ready to reopen business in Philadelphia?
I think we're ready to start. We're ready to put our toe in the water and to see how everybody behaves and how everybody reacts, and look at the numbers, and hopefully we can continue to move forward. Obviously, standing in the place we're standing in now forever isn't tenable, but we think with Dr. Farley's advice and with good plan that we have a chance to move forward out of this red and into the daylight a little bit.
Mayor, you've always said that you're going to follow medical advice. I'm curious if you think political pressure out of Harrisburg is moving things along too quickly.
No, I don't say that. I mean, I understand everybody's concern. I mean, people are suffering both medically and financially. And, folks are losing their houses, can't pay their rent, losing their businesses. So, I mean, I don't think it's political pressure. I think it's a practical situation that the numbers seem to be where they are, that we can take this mini step forward. And obviously everybody's ready for us to do so. We just have to be vigilant and be ready to pull back if we have to.
Thank you, guys.
Thank you, Mitch.
For a sec, as the plan lays out, there's a clear health risk to the virus, but there's also a health risk to the economic damage from the shutdown. There's a good body of literature that says that poverty is not good for your health. To put it more bluntly, poverty kills too. The virus kills, poverty kills. We're trying to come up with a balance here to protect everyone as much as possible, where we can allow economic activity to occur so we're not having severe impact of the shutdown while also suppressing the virus.
All right.
Thanks, sir.
Thank you, Mitch, and thank you, Dr. Farley. Now we go to Maggie Kent of 6ABC.
Hi, my first question is for the mayor. There is a protest planned tomorrow at noon outside of City Hall in regards to George Floyd. How is city leadership prepared to react and deal with crowd control?
Well, we very much understand the outrage that is in people as a result of that horrible scene that we saw on television in Minneapolis. We're used to people protesting various issues. It's their right to protest. Our only rules are you can protest as loud and as long as you want, but the destructive property or hurting someone else will not be permitted. But we're very well schooled from the Republican National Convention onward on how to handle these events. We'll be respectful, and we expect people to be respectful and to express their anger, express their concern, and we'll all work together to have a safe day.
My second question is in regards to the groups of 25. And I just want to get some clarification on this. Is this a departure from what Governor Wolf is allowing? Is it saying here in the city of Philadelphia, while the governor says yellow would allow groups of less than 25, the city is saying it is not allowed?
The city is saying that is allowed. We are not changing the legal status of that. However, we're issuing a strong recommendation to the people of Philadelphia to not have gatherings of any size because of the potential risk.
And will there be any punishment or enforcement of groups of less than 25 meetings? So as you mentioned, Dr. Farley, having a church service, you don't want to see that. But if it does happen, will there be a shutdown in that case?
No, we would not be shutting down a service that is legally allowed. We might be educating people who think this is not in their best interest or the best interest of the city, but this is a recommendation. A lot of this really does depend on the voluntary participation of Philadelphia residents. And as much as people may worry about that, I think what we've shown is that people in Philadelphia have listened to our advice and have been very responsible. We just need to continue that responsible action as we move to the next phase.
Okay.
All right.
We didn't.
Maggie, we're limiting it to 3. We'll try for a second round if we can. We go now to Jeff Cole of Fox 29. Hold on one second, Jeff. Try it now. Go ahead.
We're doing all for the mayor, if I could. We all okay?
Yep, go ahead.
Here we go. Mayor, I want to make sure I'm quoting Dr. Farley accurately. I think he said here, social and religious gatherings can be very dangerous, quote, end of quote. Have you spoken to religious leaders in this community that you think that religious gatherings could be dangerous for people's health? And if you have, what have they said? If not, why not yet?
Well, because I don't understand the question. Did Dr. Farley say this or I said this?
Dr. Farley said social and religious gatherings can be very dangerous based on your recommendation of gatherings under 25.
Well, it's a group of people together in close proximity to each other. They can transfer the virus from one person to the next. As the example that he gave was a 61-person choir. One person was affected, 52 people got the disease, and 2 people died. I don't think you really need to ask an opinion about that. It's fact, and that's what we're concerned about. Of course, we're not going to go in and shut down a religious service, but we're basically saying we strongly recommend that people do not gather in groups.
Don't you think religious leaders are going to be fairly upset about that sort of phrasing? And they're going to argue that certainly what they do is important for folks in some way?
It is important, but it's also important that we don't infect each other and die.
Last question, I guess. This is my third. You've asked for, in essence, residents to enforce some of these recommendations. Throughout the country, there's been violence when residents and even businesses have tried to enforce folks wearing masks and asking people to step back. Are you prepared for the kind of violence and reaction that could happen there?
The example that Dr. Farley uses, and I think it's very, very apropos, is that indoor smoking right now is something that's a total taboo. And the reason it's a total taboo is because if you light up in a room with other people, they will tell you to put it out, and the cigarette smoke bothers them, and you should be smoking inside. And I think that people have gotten used to the fact that you don't light up a cigarette inside a building. And people socially enforce that. And people will get used to masks and ultimately socially enforce the wearing of masks.
I get one more, Mike, or am I done?
Try for a second round. Just raise your hand in a second, and we'll see if we can get back to you. I'll go now to Sean Walsh of the Inquirer.
Thanks very much. Can you outline any other differences between the state's yellow phase and this plan, aside from the recommendation on up to 25 people?
Doctor?
That's the social gatherings is the key one. There was another one around private pools, such as swim clubs. We're worried about that becoming a gathering, and so that would be prohibited in this. There are elements of as far as specific activities, those are the main differences. But then the way in which people engage in those activities, the safe mode guidance has not been spelled out in the state's order. That is spelled out in the city's order.
Yeah, and just to add to that, Sean, we are, and as we mentioned yesterday, we're still working through outdoor dining as well. Then I just want to make sure that we reference that.
Thanks. So cases are still much lower than they were, obviously, a month or so ago, but they are a little bit higher, it seems, in some of the recent daily counts than they have been, or at least the pace of decline seems to have slowed. Is that accurate? And Dr. Farley, did that give you any concern that that's happening at this moment that you were formulating this plan?
Yeah, if you follow the daily case count numbers, they have not fallen as fast in the past few days as they have the days before then, but we are getting more testing. More testing is a good sign, and so we have to take that into account. As far as am I concerned, I'm always concerned. I'm following these numbers every day, and I did express very clearly that the June 5th is still tentative. If the numbers look bad between now and June 5th, we're going to delay this, and so we just have to follow those numbers every day.
Got you. Thanks very much. And Mayor Kenney, do you how quickly would you consider undoing some of the loosening of the restriction that we're looking at today if the numbers started going back up? Is this going to be a day-to-day thing, or is there we'll reevaluate in a month?
It's a day-to-day thing. I mean, it's been a day-to-day thing since the beginning of March. So yeah, I mean, if the numbers begin to take a bad turn, we're going to have to pull back. I mean, it's the only thing to do. You can't just put your head down and run into the burning building. We'll see how it goes.
Okay, thanks very much.
All right. Thank you, Sean. We'll go now to Denise Clay of the Sunday.
Good afternoon. The governor of New York issued an executive order saying that businesses have the right to refuse services if you are not wearing a mask. Has there been any talk that you've heard from the state about doing that in Pennsylvania? And would you consider doing something like that in Philadelphia?
I mean, Dr. Farley said this before in the past, and you've seen it a lot of times if you go to the Jersey Shore, no shoes, no shirt, no service. I mean, so just add the word mask to it. It's the same thing. Okay.
Also, City Hall itself, is there a timetable for when it's going to reopen for people to come in and get, various services?
Stephanie or Brian?
Sure. So I won't say that City Hall is just going to reopen, come June 5th. I think there's certain services that happen or facilitated in City Hall. Like I mentioned, the records department, deed reporting, some limited functions with the Register of Wills. Those, certain services will begin to reopen throughout the yellow phase. So, it's not going to be just a grand reopening necessarily of City Hall, but of certain offices or services that are working out of the building itself.
Okay. Now, my last question, and this goes back to enforcement. You've probably seen stories of people trying to enforce mask restrictions in retail settings where people have been spit on or hit or something. That's assault in most places. Will the police be called in those instances? I know that you're not going to be called for just like one of the mill, hey, this person's not wearing a mask. But if you spit on me, especially during a pandemic, that's assault with a deadly weapon. Will the police, be called in for that?
Police are called into a circumstance. They will evaluate the circumstance, listen to the witnesses. If someone was physically hit, that is an assault. I would suspect the person will be taken into custody. As far as the spitting is concerned, I consider that to be an assault, but each individual situation is different. And that's why police officers, are able to, or mostly able to judge situations and determine what best action to take.
Okay, thank you, Denise. We'll go now to Martin Pratt of YBN Philly. Hold on, Martin. Martin, try to unmute yourself there. There we go.
Is that it?
Yep, you're good.
Okay, great. Thank you. This first question is for Dr. Farley. Dr. Farley, can you explain for my readers a little bit more about the singing issue and how important or how significant the voice is to getting this infection?
When you cough, when you sneeze, when you talk, you put out droplets that have the virus in it if you have the virus, and that's what transmits it to another person. Singing is an opportunity where you're really putting forth a lot of air from your respiratory tract. You're going to be putting out more of those droplets. It hasn't been proven, but it's certainly widely speculated that singing would increase the risk. And that's, religious gatherings, often singing is a key part of that. So that's one of the reasons we're particularly concerned about that. That's the idea.
Second question for you, Dr. Farley. Could you explain a little bit more also about if this church decided to have an outdoor service and they were doing 6 feet apart, would that fall under the recommendations? In other words, they're making sure that they're 6 feet apart, they're outdoors, not inside the building, right, and no singing. Would the city not frown upon that?
We would still not recommend that. We're not prohibiting that. We're not recommending that sort of gathering. People will, I imagine some people will do it anyway, and if they do it, I certainly hope that they'll follow the rest of the key elements of our safe mode guidance.
And this probably is a two-person answer. I'm not sure. You mentioned in your presentation, which was excellent. Thank you for the presentation. Very simple and succinct. I know we'll be able to pass that on. In that, you mentioned one of the groups that you're looking at that's disproportionately affected are racial groups. Will you work with, or are you planning to work with people like the Black Doctors Consortium? And wanted to see what Bryant felt about that question.
Sure. So, I think we commented yesterday that the Black Doctors Consortium have responded to an RFP. We're in the process of evaluating that RFP, but certainly appreciate what they've already done for the community and hope that we can partner with them in the future.
Thank you.
Thank you, Martin. Let's go now to Claudia Lauer of the Associated Press.
Hey, how are you? I had a couple of questions. First, you said that there were going to be 2 specific early indicators you were going to be looking at. I thought I caught those being the SCINSA fever tests, the monitors, and then also people who show up for treatment of like flu-like symptoms at the hospital. Is that correct?
Well, the first one was what I called internet-connected thermometers.
Thank you.
People at home, if they have a thermometer, they measure their temperature. That gets into the internet. If a high percentage of them are fevers, that's an indicator. Yes.
So those internet-connected thermometers, and then the people who show up for flu-like symptoms.
Yes, or symptoms that would be compatible with the COVID infection.
Okay, thank you. And then secondarily, I think I just got confused off of the answer from another question. So the city is not recommending social gatherings or religious gatherings, or you are still prohibiting them?
We're not prohibiting them. We are strongly recommending against them.
Got it. Okay. And then my last question is actually about preparations for protests this weekend. A lot of the protests that have gone on around the country have escalated. And I'm wondering if you can outline or talk at all about what the preparation for the protest on Saturday at City Hall looks like.
Right.
Yeah, sure. So we're finalizing our operational plans for Saturday. I think our police department have a long history of being able to manage protests extremely well. I can't, never in my memory have we had to resort to tear gas or anything like that we saw in other jurisdictions recently. And I would expect us not to have to do that now. I think, as the mayor said, people have every right to be outraged. They should be outraged. And But I have every faith in our police department to treat people's First Amendment rights with respect and with dignity. And, I think they've proven it over and over again, and I expect them to prove it this weekend.
Thank you.
Mike Dunn?
Yeah, I guess it would help if I unmuted myself also. We're going now to Laura Smythe of the Philadelphia Business Journal.
Hey, good afternoon. My question has to do with the outdoor dining, just looking at the safer at home guidelines. Wanted to confirm that it would be accurate to say, based on those, that outdoor dine-in service is prohibited at restaurants, whether on privately owned space or sidewalk permits, is what I was seeing from the guidelines. And if so, just what the decision process was like for that.
So it's prohibited until we can issue further guidance. We've had a team working on this issue for a couple weeks. As I said yesterday, the issues that Philadelphia faces are condensed and smaller streets and rights of way. Our density of buildings, we're a little bit different than some of the other jurisdictions in the Commonwealth, and we want to make sure we get it right. So we hope to have those guidelines shortly, and do expect to permit outdoor dining at some point in the near future, but we're just not there yet.
So is it, just to clarify, would it still be up in the air whether June 5th could be on the table, or is that kind of definite not?
Right now, June 5th is we're not going to permit outdoor dining on June 5th. If something changes, we'll certainly let folks know next week.
Sure. Thank you.
All right. Thank you, Laura. We're going to go to Howard Monroe of CBS 3.
Was just asked. So thank you.
There you go, Howard. Howard, are you there?
Yes, I was saying that my question was just asked, so I don't need it.
Okay, very good. Thank you, Howard. Let's go now to Pat Loeb of KYW.
Hi, Dr. Farley. At the height of the outbreak, the percentage of tests that came back positive was about 30%, as I recall. What is it now?
It actually peaked at closer to 40%, and now it is right around 10%.
Thank you. That's my only question.
All right, Pat. We're going to go now to a second round. We have about 10 more minutes that we can go, and let's go to Rudy Chinchilla of NBC 10.
Hi, guys. Well, thank you guys first for hosting this very informative press conference. My question is, I'm looking through the guidelines through one of the PDFs that you guys provided, and there's language on sick leave. It says, businesses should have sick leave policies in place. But I'm wondering, is that a requirement for businesses that open, or is that more of a suggestion from the city?
That is guidelines in that document. I think the city solicitor, Marcel Pratt, is on, and he may be able to answer some about the what is required and is not required around sick leave.
Yes, that's right, Dr. Farley. Those are simply guidance. Obviously, there are laws in place that provide for a variety of sick leave, and those will be enforced. But the general statement that you have in the guidance is intended to encourage employers to be flexible.
Okay, so like if an employer doesn't have a sick leave policy in place, I guess sounds like they can still reopen because it's not necessarily a requirement, right?
Well, they still might have legal obligations under city or federal law. So they need to comply with those laws if they're going to reopen. But the point of the guidance is simply to encourage employers to be flexible.
Understood. Thank you. And Armando, no sé si podrías también darnos una respuesta para esa pregunta en español. Otra vez la pregunta era si los empleadores deberían dar baja por enfermedad, si es requerido o si es sugerencia.
Baja por enfermedad. Específicame un poquito, por favor.
Bueno, es la misma pregunta que hice en inglés. Si las nuevas pólizas dicen que los empleadores deberían dar baja por enfermedad, si es requerido o si es más sugerencia por la ciudad.
The question, once again, is the same as was asked before, whether there are any orders or just suggestions on behalf of the city for employers to leave, let employees leave due to disease or illness related to COVID-19, ¿verdad? Rudy?
Sí.
Related to COVID-19.
Marcel, are you able to kind of summarize your answer so that Armando could translate that?
Yeah, sure. So the guidance document is intended to ensure that employers are being flexible when folks do say they're sick or they want to use sick leave. But at the same time, there are very specific laws in place that guarantee employees the right to use certain levels of sick leave. And employers have the obligation to follow those. But this guidance document was not intended to alter legal requirements around sick leave.
Bien, existen documentos que nos permiten tener pautas para los empleadores con respecto a la flexibilidad para sus empleados que estén enfermos y que pueden utilizar sus días de enfermedad según lo indica la ley. La ley garantiza estas prestaciones y los empleados pueden tomar sus días de descanso o sus días de enfermedad según lo que existe. El documento que se ha emitido es sencillamente una guía, no es una orden ni es una ley.
Thank you
very good.
Gracias, Armando.
Thank you, Armando. Thank you, Rudy. Let's go back now to Jeff Cole of Fox 29. One second, Jeff. I'm trying to unmute you there. Jeff, try unmuting yourself if you could. I seem to be there. Go ahead. You're good.
Okay, I just had one more for the mayor, if I could. Mayor, it looks like businesses now will have at least some role with enforcement. Provide masks, barriers, isolate, that sort of thing. Provide distance. Is the city able to? Has it considered providing some sort of legal liability protection and shield businesses from illegal claims by merchants? Employees who can make a claim they contracted COVID inside their establishments?
I'd have to direct you to my lawyer.
Oh, bad. Okay.
So that's not something that the city could provide, but at the same time, we're not making it a legal obligation for businesses to enforce. Again, this is more so guidance. We're talking about the concept of shared responsibility. And the city can't be present in every business at all times. So we are asking businesses to do what they can, basically.
And Jeff, I actually want to just touch on, I understand that some of these requirements are going to be hard for businesses to meet without some financial assistance. And we're in active conversations about what assistance the city might be able to provide for personal protective equipment, some of those plexiglass barriers, et cetera, in order to make this easier to comply with. We're mostly focused on compliance rather than on enforcement.
Yeah. Okay. Thank you.
Thank you, Jeff. Let's go back to Sean Walsh of the Inquirer.
Thank you. Mayor, of all the changes that could happen on June 5th, if this goes through, is there one in particular that gave you pause or the one that you are most concerned with?
No, I've been concerned about everything every day for the past few years, but especially in this particular environment. Nothing really pops out as overly concerning or overly reassuring. It's just all new ground.
Got it. That's all I had. Thanks.
Thank you, Sean. Let's go back to Maggie Kent of 6ABC.
Just one question, maybe Marcel, you can address this in regards to people who may be uncomfortable returning back to their workspace. Are there any protections for those people to be able to maintain and keep their jobs, even though they feel unsafe to return?
That's a good question. So a lot of that is going to be determined by policies that the employer itself has in place. And then again, applicable federal and city sick leave requirements. That's not going to be touched on in the actual guidance or any of the orders that we're issuing, but it's really going to depend on a case-by-case basis. And employers are again going to have to follow the various sick leave protections that are in place.
Thank you.
All right, thank you, Maggie. And we'll go back now to Martin Pratt of YBN Philly.
Hi, can you guys hear me?
You got it. Go ahead, Martin.
Okay, thank you. Mayor, I was thinking about what you just said and the weight of you being worried on a daily basis for this number of years. This is also what I think the average citizen is going through. So has there been any thought or planning for mental health services, an additional or a city campaign for people to be able to talk about what they went through this pandemic, what they're facing now? As someone just suggested about the worry about the jobs and being evicted. Is the city doing anything around mental health services?
I believe, and Dr. Farley or Brian, correct me if I'm wrong, I do believe there's a number that folks can call to talk about their feelings and issues and concerns.
Yeah, so we have a number of mental health services that are still available through the pandemic, and have early on had a press conference directly related to those mental health services. We're happy to send those materials around again. I don't have the number on hand, but certainly can provide it, and certainly recognize that this has been probably the most challenging times. Well, at least we'll certainly hope the most challenging times in our lifetime, no matter what seat you're sitting in. And recognize that we all need to stick together in order to get through this together.
So, Brian, there are no budget cuts for that, though?
No, there was not.
Thank you.
All right. Thank you, Martin. And that concludes today's daily briefing. We do have this important note. Starting next Monday, June 1st, we are moving these briefings to a Monday, Wednesday, Friday only schedule for members of the media. Press releases will continue to be distributed Monday through Friday. But again, next week's schedule for press briefings and beyond will be Mondays, Wednesdays, and Fridays. Thank you.